Hi everyone, my name is Kavyan Zoughalian from Sheffield Hallam University. I'm a PhD student. I'll be talking about my project, which is the access control mechanism in social assistive robots. Social assistive robots in general, um, they're used for, especially in healthcare, they're used with the elderly to support independent living and also assist in the day-to-day task of the patients, and as well as helping and assisting with the healthcare staff to offload some burden of their workload. Um, so they've been widely adopted across the Europe um, on in healthcare in specific. This is our image from the EMR competition. We used the RE humanoid robot to help with the fall detection and call for assistance when it was detecting a fall from the smartwatch wearable data and the vision. So, oh, so this is another um, assistive robot that we have in the lab. Is the care robot. So I just want to talk about the components of the robot. Is consistent of multiple PCs and a lot of sensors, such as the depth camera and proximity sensors. It's even got routers and switches, so it's a whole network within one device. And on top of that, it can be connected with um, other sources of information, like the smartwatches or other sensors. It can have access to the medication history, um, the healthcare records, um, the calendar or the schedule of the patient, and the NHS backend. And it can interact with many stakeholders, many users, such as the patient themselves, the carers, doctors, family, friends, and nurses. So when we talk about the access control, we're going to be looking at what a robot can do. So what are the capabilities of an assistive robot? What are the capabilities of the user and the security concerns and the security needs around that? So we're looking at the intersect between all these three. So as I mentioned, it's the robot's capabilities, the access needs, the access rights, and the permissions, and the conditions and obligations. Conditions being um, things such as um, the timetable or the rota of when um, the staff can access such data, and obligations such as the access log. So once they access an information, it should be logged. So in general, we put the architecture of the robot into 4 layers. The first layer being the interaction layer, the interaction language and scene understanding layer, and the second one being the security safeguard or the access and usage control. The third one is the execution layer, where the robot can perform tasks such as bringing the medicine to the patient, um, or giving access to a stakeholder. And the fourth layer is um, the sensory data, memory data, and the storage system, um, um, the lower level of sensor information, the raw data. So that in an interaction or like a scenario, we're looking at um, a few things um, in the access control. So from the user requesting an information to the robot going through certain processes to control the access of the information that's given. So the request given to a process called the policy enforcement point, which is the context handler, which um, puts the context of the request from an unstructured to a structured request given to the policy decision point, where the policy decision point can retrieve resource content, resource attributes, and subject attributes to make a decision and either accept or deny access request. And that would be in the second layer between the interaction layer and the execution layer. So that in a overall picture, it would work in this way, where the user will be requesting an information or requesting an action from the robot, going through the authentication process, then from the data sources that the robot holds and the policies that's been given to the robot, it can make a decision. So the first or the initial problem within this scenario or this overall idea is understanding the request. So when we're talking natural language, it's quite difficult for a system to understand. So this is normally, or with the recent improvements of large language models, this is normally given to the large language models, and they understand the natural language pretty well. But the problems of the resource constraints of the robot, so it's a robot with limited battery size and limited resources in terms of the computation, it's not possible to have a large language model on board. So we rely on cloud-based systems, the large language model as a service, in a sense. So that kind of is problematic in healthcare, because we're giving out sensitive information to a third party or like a cloud-based system. To resolve that, I was working on applying principle of least privilege onto working with cloud-based systems, which means you rely on the cloud-based system just for the purpose of understanding the user request, rather than letting the large language model handle the whole request. So to do that, we made the system to go from an unstructured request to a structured request. So this started with generating a specific data set for the training of the large language model, then to fine-tune the model and test it against 3 levels of complexities, from easy, medium to hard, which is easy's 1 or 2 entities within an unstructured request, medium's nested entities, and hard being adding ambiguity levels. And we got good performance. It's not published yet, so I can't really put the results. It's under review, but we got up to 95% accuracy on the model. So in terms of the ROS implementation, which is the robot operating system implementation, which is required for the robot, it comes down to a similar architecture to this. Goes through the interpreter node to the controller node, which was the policy enforcement point, handles the context to get from an unstructured request to a structured request, providing the intention of the user, of which task they want to, or what action they want to perform, and the parameters required. Going to the access policy node, which is the policy decision point, in retrieving the information that's required and coming back for making a decision. So we had a proof of concept. It was from ICIT conference. So in this one, I looked at applying physical activity guidelines for adults aged 19 to 64 from the NHS guidelines, and the doctor's guidelines, so you can modify depending on the doctor's recommendations. And I've applied it to this data set, the crowdsourced Fitbit data set, which we got the results as we expected. And the current work is the privacy-aware assistive system with the large language models, which I discussed, and applying task-based access control mechanism based on the NHS framework. Then I'll be looking at the emergency break glass procedure, which is the follow-up work from the EMR competition of the fall detection, and what does that mean for the access control and the user evaluation study. Thank you for listening. If you have any questions.
I have a question.
Yeah.
So in your picture, I say there's a distinguish the request into 3 levels. Do you have some specific methods for that to divide the request into 3 levels? Easy, hard, and which one?
Medium, yeah.
Yeah, medium.
You mean this one, right?
Yeah, the right part. Yeah.
Yeah. So it was from the previous works of in the natural language processing. It's in the paper. I could potentially. It would be on my Google Scholar soon, hopefully. But it was from the previous works to go from the basic entities, which is picking out 1 or 2 entities from the request, to nested entities, which requires some context. So like if there's any dates, specific dates, or like if there's a specific user requested within that request, to ambiguity level. So if there are multiple entities, but the user intends for one, for example, if they say, oh, I am a doctor and I want to get the patient 5's records, then there's a doctor and a patient within the same request. So the model needs to know which one they want the information for. So it's just adding the ambiguity level to the hard complexity.
Thank you.
You're welcome.
So what do you think is the most challenging part of building such a system?
Oh, the most challenging part, there are a lot of challenging parts. The main one is potentially, there are a couple. So one is the speech to text recognitions. They're really bad, and they don't get the exact words sometimes, so that's quite challenging. And another one is linking the healthcare tasks to what the robot capabilities are, because there's no cognitive architecture on top to be able to get all these sensory data and make it meaningful in terms of the tasks that are required for healthcare. So mapping those are quite challenging. Yeah.
So do you think that like we should focus more on the device side, that we have better device like for the things you mentioned, speech to text conversion, or we should try to improve our algorithm?
So it would be a trade-off. So like you could get better algorithms to better models to get the speech-to-text recognitions, but there are like better ones, but it require more resources. So you have to put better resources on the robot, but that means more battery usage, which means you have to add a bigger battery on the robot. And then if you rely on the cloud-based, if the internet's down, then there is no access to the services of the robot, and that's a big no in terms of healthcare. So if there is a emergency scenario and the robot is unavailable, then it would be a problem.
I see.
So it's a trade-off, I guess.
Do
Yeah.
you ever have any ethical concerns when it goes to NHS system,
In terms of which part of it?
like patients or?
I mean, the main one is the privacy. So why the access control is required is each stakeholder, they don't need all the information to do their tasks. So a carer doesn't need the same level of information as a doctor, and same with the family and friends. So a trade-off between like what the user wants in terms of the privacy and what the stakeholders need to perform their job is an ethical concern. So
See. Yeah. Thank you.
I have a question. So what kind of conditions can you track and advise on? Because obviously their well-being activity data is not going to be relevant for everything. So yeah, what kind of conditions can it address, and where have you found limitations in the framework?
what kind of concerns? I didn't understand the question. Sorry.
What kind of conditions can you track? Because obviously the activity data is not relevant to everything. So what kind of conditions can it track and address, and where do you see limitations in the entire framework?
Okay, so what I'm working on now is a task-based access control mechanism. So depending on what the stakeholders are allowed to do in terms of tasks and are relevant in their daily activities, according to what the NHS informs us, which is the National RBAC database. It's a huge database. So I'm mapping those to what the robots can do and what each stakeholders can do. And yeah, so in that sense, the conditions would be controlled in terms of which user is allowed to perform what task. And the limitations are exactly that. So, like mapping the capabilities of the robot to what the healthcare staff need, and what each one requires on a daily basis is the biggest limitation. Thank you. Thank you.